I wanted to talk to you about the engineering of infant formula consumption. Uh, I've been taught by mentors that everything that you see is designed. And to the extent that formula consumption is increasing in babies throughout the world, this is exactly the plan of many in the system. And one must understand that plan if we want to reverse those trends. But I also want to add a little bit of complexity to talk about how there's also a place for formula in the world by talking about some of my experiences as a public health professional. So specifically, I wanted to identify resources that you can continue to use and study and bounce ideas off after this talk. I wanted to uh, really go through the engineering of formula addiction to babies and families. And lastly, I will give a case study. Since I can be long-winded, as I'm told by my wife, I will break this discussion into two parts, talking about the first two objectives uh, in one in one session and the case study in another. All right, so let's talk about the resources that have really been meaningful in my life, and I would love to share with you. The first is a book by Tracy Kidder called Mountains Beyond Mountains. I read this while I was working in the hallowed halls of the United States Senate, and immediately I thought, I need another job. It basically told the story of a man named Paul Farmer who established the formal international health endeavor, the idea that we, with resources, can be of use to those with less resources. Now, Paul Farmer was a great man, and we became friends. And I interacted with him in Rwanda, 2006 and 2007. And I think what he really taught me was that A, we don't do over somewhere else that we would not do here. He called this a preferential option for the poor, but I think what he meant by that was that people with less resources should be just as respected as those with resources. The other part was for the need to do what was logical, which often meant to question what the system would say. So to put that into a little bit more concrete terms, when I first arrived in Rwanda, about 3 hours out of the capital, I learned that Partners in Health was in a fight. The fight was against the CDC and the WHO about the recommendation for exclusive breastfeeding for infants of HIV positive women. Now, the WHO and the CDC in that time said you must give breast milk or else these babies will die of dehydration, diarrheal disease. But Partners in Health said, wait a second, if you breastfeed, that you're almost guaranteed a 50% seroconversion rate of those previously uninfected babies. And so they said, well, why don't we do what we would do in the United States, and that is to put the children on formula. And the opponents said, no, 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 that would be too complicated. You have to not only get the formula, you have to teach how to use the formula, which is in the form of powder, how to mix it. But then again, you have to buy fuel and stoves, and that would add to the cost. And Partners in Health said, well, we're going to do what we think is just. And they did it. They provided these things, and they even did return on investment analysis that it was much more economical to prevent a baby from getting HIV than to not provide it formula heated by a gas stove for a year's time. And 10, 15 years later, it became the policy of the WHO, of the CDC. And here's a piece of, a memo from the National Institutes of Health, the AIDS section saying, hey, just a reminder, those infants born of HIV positive mothers, they should get formula in almost all cases where it's available. Okay, so the other thing that Paul taught me was that you have to fill in gaps in knowledge, that if you don't know it, just do it. So as I progressed in my career, I found that I was giving more and more advice about childhood and um, baby nutrition. And I realized that as a man, I didn't really know what that meant in a fundamental sense. And basically, I could not breastfeed. So I decided to learn from the best. Here is a picture of one of my mentors' clients. Her name is Grace McNair, the mentor, and her QR code's at the bottom right. She has just a great Instagram. You can sort of see how this gets done. But I worked with her to become a lactation consultant. And you can see how great it is to orient your career around health and relationships and natural things. I learned a ton. Here is a video of Grace showing a baby in the guppy pose. That is a position that can relax the baby, which is often stressed and clenched down like this. This was just one of many things that I learned in addition to baby massage, in addition to the importance of positioning in breastfeeding, in addition to the level of support that it took to get Grace's services, which was essentially $250 an hour. Breastfeeding is hard, and it made me realize that many of the policies, which we'll talk about later, were oversimplified because of the limitations of professionals like me in understanding proper nutrition. In fact, when I was in training, we learned that if a mother could not breastfeed, it was only because she wasn't trying hard enough or her nipples were inverted and she just needed a suction device. But with this type of training, I learned that there were maternal factors, but also baby factors and environmental factors. Another great resource that I really kind of changed my life back when I was a public health student in the early 2000s was the book Food Politics by Marion Nestle. I know many of us are taught to think that politics, especially now, is a dirty word, but it's not. Politics is simply the game that is played to get your agenda on the decision-making table. So Marion Nestle in Food Politics talks about the game of food and how it's important to engage that game, because if you don't play in that game, then you don't get to win the game. It is filled with graphs, pictures, tables, case studies, stories that really puts into a whole new light, even things like the food pyramid, um, and makes you realize, wow, uh, it's very, very much engineered the food that we eat or don't eat. Here's just an example of some of Marion Nestle's content on formula uh, consumption by babies. It shows that in the 70s, when I was born, I was exclusively not breastfed and suffered the consequences of that, I'm sure. It was not cool to breastfeed. And the reason why is because there were very heavy campaigns to show that infant formula was far superior in a place that could afford it than breast milk. Well, that worked for a long while, but then Nestle specifically, because it dominated the market, came under tremendous fire. And this table shows from 1977 to 2000, all the discrete things and the millions, hundred millions of dollars that went into designing a campaign that could increase the company's public relations view and increase their bottom line. And they succeeded in doing that. One point of this type of table is to realize if the private sector is so deliberate about its interventions, well, the public health sector should be too. So no single campaign or we should just do fill in the blank, but we also have to have the equivalent of a 23-year plan. One thing that bothered me as I was reading these books or growing up and working, I always thought, are my opponents evil? That's probably a hoity-toity stance, but the answer is no. The answer is that we all must support what makes sense of our lives. So I often think about the formula executive who gets babies to drink their formula and not their mom's breast milk. Well, they have a family and they have a lifestyle, and their stance supports that. And it'd be very, very difficult for them to change their stance without changing the story that makes sense of their lives. James Baldwin put it, any real change implies the breakup of the world as one has always known it, the loss of all that gave one an identity, the end of safety. Now, my perspective is not to not force change. In fact, that's what we need to do, but just know what is happening to those that you try to change in the process. Okay, so let's talk about how the world gets hooked on infant formula, not just the United States, although I do tend to focus more on US policy since it is more familiar to me. I like the way Marion Nestle put it. The first was that breast milk is superior, period. It helps babies grow better, adjust better, helps them to avoid diseases better. And we'll go into the specific advantages, not only for the baby, but for other members of the family unit. The second point is that despite the challenges, and we will talk about challenges, every mother who, or most, the vast majority of mothers who want to breastfeed can breastfeed exclusively to a year, which is the ideal. And last, that even though every mother can get there, who wants to get there, just a little push towards formula is a way to make the whole endeavor of exclusive breastfeeding fall down. And we'll talk about exactly why that is the case. Okay, so breast milk is superior. We talked about how, and here's a list for the baby, that baby first does not become overweight or obese. I know there's controversy about that, but sucking is a reflex. And if you stick a nipple and milk behind it, let alone one's finger into a baby's mouth, it's gonna suck. And so with the gravity, with the volume of formula, babies often overeat. The best case scenario is they have GERD and reflux disease, but they often overeat, and babies nowadays are bigger because of formula. Health-wise, or another health consequence is that babies with formula don't get passive supply of the mother's immunoglobulins, which are so important in fighting off disease. And one cannot, on both sides, diminish at all the type of relationship that grows between a mother and a baby in the process of nourishment. I am the brother of three older sisters, and my elder sister once said to me, you know, Wilson, you'll never understand how great it is to breastfeed. The type of connection and feeling you will never know. And I respected that. But from a male perspective, I also said, that's yours, and I'll take your word for it. Well, how about mothers? Not only do mothers get that tremendous emotional connection, but turns out that they suffer decreased diseases too, cancers in their latter years, both breast and ovarian cancers. I don't know the mechanism for that, They also are able to maintain weight better, and it is a great way to a great natural contraceptive. And let us not say, and I remember with this with my own daughter, that it is so expensive to buy formula. Not only does it result in stinky poop, but it really empties the coffers in terms of how much it costs to buy all the supplies associated with formula feeding. The second point of Nestle is that everyone can breastfeed. And if you don't think Rwandans are superior to us Americans, you can see that Rwandans breastfeed exclusively to 1 year to a rate of 95%. And even the Liberians in hot pink are at 75%, and the United States in the bottom at 50%. Well, how did we do? We were a rich country relative to these other of these. We are rich relative to these other countries. How did we do just looking at ourselves? Well, quite well. 90% exclusive breastfeeding in the 1900s when formula did not exist. So that makes sense. You don't breastfeed, your baby will die. But we do see a dramatic decrease as the private sector realized that, wait, it's not only that demand creates supply, but supply can create demand too. And thus was the roots of the advertising industry. This is data from the WHO, CDC, UNICEF, DHS, and NCHS, all put together. So the last is that there are many ways to stop a woman who wants to from breastfeeding. And I like this model because it shows how to engineer it one way or the other. So you can get people to stop, but I would actually use the same model to stop. This is a behavioral change model. And you'll see that the top line is individual. There are individual motivations and abilities to breastfeed. So I can want to do something, but am I able to do something? Desire versus resources. And the next level is social. We are social creatures and we depend upon peer group pressure in terms of motivation, but also peer support in terms of ability. And finally, what is more powerful than personal is the social, but what is more powerful than the social is structural, not even thinking about anything, it's just happening. So structural motivation, like there is no place to pump at work, okay? That is a type of structural motivation in the negative direction. But structural ability, there is a place to pump at work, and I get 3 months off to exclusively breastfeed my baby from work. That would be structural ability. Of course, in the United States, I believe the law is only 1 month off. In Denmark, in Sweden, would you believe 2 years off? Not only for the mother, but for the father too. Okay, so let's give an example of individual barriers. So what I mean by motivation is that the mother, she wants so badly, more so than the father, for the baby to stop crying. But yet crying is essential to breastfeeding. The body is constructed so that the baby crying for about 36 hours straight leads to stress and the release of oxytocin that then, and other hormones, such as LH and all estrogen, all the good stuff, to let down milk. This is important because you don't want to be at the grocery store before you deliver your baby and be lactating in line. But this is very stressful. And you can imagine what happens in terms of your desire to breastfeed. You're trying to breastfeed, you've never really done it before, and then all of a sudden someone brings you a bottle and the baby calms. This is my own baby, Drew, and she got both breast milk and formula mix because my wife and I are older, and it was more difficult to exclusively breastfeed. So that's the motivation part. The ability part is I want you to know that even to this point, to get half breast milk, we had two lactation consultants that cost $300 an hour, and the first one wasn't good. The second one was okay. But the ability to do stuff as an individual depends upon access to resources. Not everyone has that. Okay, so let's look at social motivation. Well, the big problem in terms of pressure is in the United States is that breasts are looked at not as nutritive organs, but sexual organs. And so young mothers, for the first time, have to look at their breasts differently, but then all of a sudden their peers, and we don't have a, a culture of supporting women breastfeeding, particularly in public. And so you get this type of headline: America's sexualization of breasts is so pervasive, even other women think public breastfeeding is gross. And you would just have to go to the polls to hear that. So this social motivation, oh, people are like looking at me funny, and then social ability is kind of the same thing. No one is really kind of nurturing me as a group, a lot due to the formula companies in the 1970s that discouraged a whole generation of women not to breastfeed. And now, so the next line, they can't necessarily help their children. So finally, structural motivation, this idea that, you know, you weren't really thinking about formula feeding because you had read everything, but you constantly are barraged with commercials that say, hey, you should make your child smart. Or you're at the hospital and the milk is simply donated there. So there's tremendous structural, in this case, candy to make you think, okay, this is the better way. But in structural bear, I do think some factors are more important than others. And in this case, it would be the public government push for formula feeding. This is a table of WIC funding, and it shows that in the $6 billion program, even though 221 million upper left is spent towards breastfeeding support, ironically, 3.8 billion is mostly to supply formula. So you're like, yeah, you should breastfeed. But hey, but do you want this free formula? Which, by the way, we better spend because then our budgets will be decreased the following year if we don't spend it. Well, by the way, where does that supply even come from? Well, it's related to the U.S. dairy farm subsidy, which is $1 billion. We adults just don't drink enough milk, and so there's leftover milk. So that milk is purchased by companies, reprocessed, relabeled, and then sent to our government in the form of WIC products. So let us stop right here, and I will talk about a case study in the next clip. But in summary, great choice in profession. Many researchers out there. You have to choose carefully. I love Marion Nestle because she really talks about what is the actual issue at hand. And then indirectly, Paul Farmer, uh, via Tracy Kidder in Mountains Beyond Mountains, talks about what it is like to be a public health professional in the good fight when there's so many challenges around us. And I hope also you see that milk from the breast is natural, but culturally, it is very easy to take advantage of the challenges of breastfeeding and also what breasts mean to the younger generation to get people to not want to breastfeed. Maybe we'll try at the beginning, but not until 1 year, no way. This is not to say that women should not have a choice, but this is to say that whatever women decide, they should have a free, unadulterated by formula choice. Thank you so much.